that you're all taking the SAGE test there. My goal today is really to try to help explain some of the issues that can come upon us as we get older with memory or thinking. And some of these issues can be pretty normal for aging, and some of these issues can indicate that there's some brain condition. Could be a dementia coming on, Alzheimer's, all sorts of other things, strokes, you name it, can affect the brain. So the goal is just to sort of give an idea of what types of things maybe are okay and just normal and don't worry about it, and maybe the other things to get in to see your physician about. And the reason that we mention that is because, as with any medical condition, as all of you are very familiar, the earlier you are identified and someone knows exactly what's going on, you have more treatment options, right? You have more things that you could potentially treat to mitigate or reduce, the effect on the brain. And the later something is progressing, the worse your diabetes is, or the worse your kidney or liver disease is, your heart disease, or your cancer, or whatever it is, there's less options for treatment. And so one of the biggest points to tell you to start off with is we'd like to take our brain health seriously and don't procrastinate. If you have an issue just like any other health issue, you have a lot more choices for treatments. If you want to keep your brain around functioning well longer, get in to see someone about it, let them know. Or if you don't think something is too much wrong with you, but your spouse does, or your daughter does, sometimes even sons think so, mostly daughters and spouses. But if someone who knows you well and tends to like you, if they're seeing something wrong, don't give them a hard time. Go ahead and go get in and get evaluated because there may be more things to do. So that's the topic today, and then we'll have plenty of time to answer questions. And we'll talk a little bit about the purpose of screening, some of the tests that you did today. Now, I don't know if anyone from my group is here, how they wanted to do the testing. If some of you already finished with the test, or... No, okay, so we'll do it afterwards. We'll have time afterwards to finish all this up, and then we do some questions. All right, so wasn't sure how long you've all had the test. So, all right. Normal aging. So we divide things, or I divide things into just three groups. There's only three types of people, in my opinion. One is called normal. I have no definition for that, And the truth is, for normal, the important thing to know about that is that every one of us have different talents, right? So what's normal for us is not normal for our neighbor or person next to us. So some people are like whiz-bang at math, and other people, and math's not their thing. And some people are fabulous at words and oratory and explaining things, and other people, they're pretty simple, and that's them. And other people are great at finding their way wherever they drive or go, and other people are just get lost turning a corner, So lots of differences between people. So normal is what you used to be able to do if there's a significant decline. If you're really super at one thing, significant decline in something that you are really good at could be something we need to look at. So that's normal. I don't know what it is, but then there's this group that if you have some decline, we call it mild cognitive impairment. So you're just not functioning like you used to. And it's because of a thinking problem, not because you have arthritis or something's wrong with your hand or this or that. You can't move very well. You're having trouble doing something because of your brain, because you can't function as well. We call that mild cognitive impairment. And those people, you can still do most things, but you're just making more mistakes. So, for example, I don't know, you forget to make a list out when you go shopping. And then you're messing up and you're not getting everything on your list, right? Or you get one of these nice something in the mail that says you have to pay some bill, and you're looking at it and you can't figure out, well, I thought I paid that, or I didn't pay that, or maybe I did. You used to be able to do this in a heartbeat, and now you're struggling. Or technology, if you used to use technology, right, and they updated it. I hate updates. They say it's trying to help my life. No, it doesn't help. Anyway, but say you used to be able to get on the internet on your 15-year-old AOL computer or whatever it is. And now you're struggling to do that, and they haven't modified anything. It's a decline in what you're able to do. You're not as efficient. That could be something. So that's called mild cognitive impairment. More trouble doing things because of your thinking. And the last group is this group we call dementia. And all dementia means is that your brain isn't working well. And it's not working well to the extent that you actually need someone else to figure what you used to be able to do on your own. So in other words, maybe you used to be able to balance your checkbook and pay your bills. And dementia would be, you have no idea where to start. You couldn't do it if you spent, 3 years looking at the stuff. You need someone else to do the bill paying for it. You just can't figure it out. Or you used to cook. And now they're trying to keep you away from the stove because you're turning it on and going to burn the plate. You have no idea how to plan a meal you just can't cook anymore. That's dementia, right? Or you couldn't figure out, you used to pay things by credit cards, but now, I don't know, what's a credit card? What's a PIN? Is this what I use? How much, you have no clue. Someone needs to help you purchase something. Or you used to be pretty good at changing channels on the TV or whatever, and now, and you think that the smartphone is the TV remote or something. So you need someone else to do it for you. You can no longer do it yourself. That's dementia. So you have to have pretty significant brain problems to get to, is that my phone? What did I win? Oh, a new fire alarm in 2 minutes. Okay. No, I'm just kidding. I don't know. So dementia is your brain is so ravaged or impaired that you need someone else to do the things that, not from a physical standpoint, but that you just can't figure out mentally. Mild cognitive impairment is that big area between normal and I can still do part of it. If you give me a reminder or a clue, no, you're supposed to go on that and you push the button down there for submit. Oh, that's right. Okay, I pushed that. You need some help, but you're still sort of able to do it with just someone cluing you or something. Mild cognitive impairment, Instead of a, dinner for 6, you can make some soup and, mac and cheese or something like this, and you can do simple things in the kitchen. You're still cooking, right? You're still doing simple things. That's mild cognitive impairment. Can you figure out how to get a dinner party for 6? No, you can be messed up with that. You used to be able to do it, but now you can't. So that's a mild cognitive impairment. And just one last thing, dementia, because it just means you're not thinking well, can be due to hundreds of causes for dementia. It's not just Alzheimer's disease. Dementia can be due, you can get to that state because you had a motorcycle accident and smashed your head and you're not thinking well, or you have 10 strokes, or you had an infection in your brain, or you have hydrocephalus, or your heart's not pumping enough blood to your brain, or your sleep apnea is so bad you can't get enough oxygen to your brain, or your lungs are not working well, or B12 deficiency, thyroid impairment, hundreds of different causes that can affect the brain, as you might imagine. All of those can cause dementia. Alzheimer's is one type of dementia, but it's because it's due to abnormal proteins that are normally made in the brain, but they accumulate too much, they overaccumulate, and they're toxic. And they start killing brain cells, particularly in the memory circuits. That's why memory is such an important thing with Alzheimer's. But it's a completely separate type of dementia condition, just one type of dementia condition amongst all the other causes. All right, so we have 3 groups: normal, mild cognitive impairment, you're sort of slipping a little bit, doesn't say what the cause is, and then dementia, where you need someone else to help to do day-to-day activities. Again, could be for multiple causes. All right, so excuse my rolling up of my beautiful name tag here. So what's the difference between, how about normal aging? Where does normal aging come in? So as we age, our brain, say we're 80 years old. Well, none of you here are probably 80, but once you get to be 80 years old, your brain is actually 80 years old. And so are your joints. And so, skin regrows. That keeps coming back. But the brain, the cells don't regrow. Those are the same brain cells you had when you were 0 years old, right? So it's not like skin. I scrape it, I rip it off, it grows back and fine, Liver regenerates a lot. There's a lot of times, a lot of different organs can help to regenerate. Not nerve cells, not the brain. So your brain is 80 years old, however old you are. So it's been through a lot of life. Hopefully it wasn't been banged or scraped too much. But so you got 80 years of toxins and damage and potential stuff. So yeah, there's normal aging things. When you get older, more likely things have happened sometime along your life to cause some damage of some sort, right? The most common thing that we see with normal aging, all the things that can happen with aging that's not due to some, tumor or Alzheimer's or some, disease to the brain, is that we become slower processing. We also walk slower sometimes too, but our processing is slower. The very fastest in your life, on the average, the very fastest that you are with processing speed is what age? Those of you who heard me before. 30, 25? 30? 0? No. So all very close. 20. 20 years old, you're like really quick. And you see them with the double thumbs and doing all this technology. You may not know much, you don't have much experience, so you're not necessarily the smartest or the wisest or making the best judgments definitely not at age 20, right? But you're fast. Your brain is working fast. And at 40, you're slower than 20, 60, you're slower than 40, 80, you're slower than 60. So there's a slow processing. You usually still come up with the right answer. You eventually get a very good judgment. If you think about it, just give me time, let me process, processing, Don't be, they're already onto a different topic already because they don't want to wait for you, these grandkids or whatever. You let me process and you'll come up with a delightful, great, well thought out, experienced, good answer, So we don't worry about how slow it is processing. So that's just normal aging, and so far we don't have anything to fix that. So you don't have to worry about that. Memory. You become more forgetful as you age. And the difference between forgetfulness and amnesia, which is what we see in things like Alzheimer's disease, where they also have a lot of memory problems. The difference mostly is that in forgetfulness, you clue pretty darn well. So for example, one that I often use, you forget your keys, or your badge, or your phone, or whatever you want to, and you're looking for it. Retrace my steps. Where was it? What did I do with it? Gosh darn it. I may use a different word, but anyway, gosh darn. And you're looking around and whatever, and there they are. Now, if you can say to yourself, I remember exactly how they got there. I dropped them because I had to put this hot pot down or whatever, the phone rang, I had to go to the bathroom, you name it. If you can think back and go, I know exactly why they were there. I know how they got there, when it happened, what I was doing. Normal aging. Don't worry about it. You're cluing well. An Alzheimer patient would see the keys there and they'll go, why did you move them there? They'll blame someone else. Usually it's the spouse. Spouse gets blamed pretty much at the top of the list. But anyway, they'll have no clue as to why those keys are there. Another example may be you had lunch yesterday. Okay, so someone asked you, what did you have for lunch yesterday? I don't even know what I did today. How do I remember yesterday? I don't. Got to go back. Lunch. Where was I here? Was I here? Was I out? Was I doing it? I don't know what I had for lunch yesterday. So they give you a clue. You went out with your daughter, and with that clue, you go, oh, that's right. Wonderful time. I went here. We did this. I had this. She had that. You remember all the different aspects of this nice meal, whatever, and of course you don't remember the argument you had with her. But anyway, you remember all these nice things. Normal. Don't worry about it, all right? But if someone says, oh, you went with your daughter, and you go, that's right, I went without my daughter, and then you go, and then you ask them, well, what'd you have? What did I have to eat? Where'd you go? Yeah, where did we go? What happened? Not normal. Go see a doctor. That's not cluing well. That's a memory problem. One-third example I'll give you is an individual who, maybe you're coming to this very important lecture today, and you're asking someone, now what time was that, whatever his name was, Dr. Whatchamacallit, anyway, Dr. Shari's lecture, what time is that? And you say, okay, it's 2 o'clock. And then, 30 minutes, an hour later or something, they're saying, oh, what time was that Whatchamacallit's guy's lecture, And they're asking you as if they had never asked it before. That's not normal. Now, it's okay to say, I know you told me I wasn't paying attention as usual. I couldn't hear you. Also may be true. You have to sort of differentiate, make sure they heard you the first time or they're paying attention, right? But you could say, I know I asked you that. I think you told me, but, what was it? That's cluing. That's okay. Don't worry about it. But when they ask you the exact same question, it's like, we just had this conversation. I just told you that, and you're polite sometimes. No, you're usually polite, and you'll answer them, yes, 2 o'clock, And if this is happening frequently, that's not a forgetfulness. That's more of what we call amnesia. It's a memory problem. You should get checked out. Now, there's lots of reasons, could be reasons for that. Could be, Alzheimer's may be one reason for memory loss, but there's lots of other things that hit the memory circuits, which are right here in the temporal lobe. So it could be any number of strokes or tumors or cysts or seizures or whatever else might be causing. So that's memory. How about words, getting words out? Okay, what's normal aging would be this acquaintance. I can't remember her name. And she doesn't have her name tag on, or, like we all do here. But I know her, and I, know about her, but I would know the name. If she told me the name, I would say, yes, that's Jane, or no, that's Judy, or what. I would know exactly if they gave me a clue, but I can't remember the name. Don't worry about it. Normal aging, all right? Some people are better at that with others, worse with aging. Or if you can't forget that actor's name or actress's name or that name of that author or book title or something, it means nothing. Doesn't mean anything in regards to getting Alzheimer's or something like that. You can do that, be perfectly happy. You can apologize. Excuse me, I forgot your name. How dare you forget my name? No. And then you'll have to live that for the rest of the, But, or you could do what most people say, hi, how you doing? Good to see you, and they try to get their name out as conversations, but what's not normal for naming or word finding is, can't figure out the names of nouns or objects. That's not like a name of a person, objects, So you're trying to figure out, like sample I often use, this thing that you flip hotcakes with, you do this and you flip it. Oh, I need one of those. Spatula. Oh, good. The cooks came out. Spatula. Okay, and you've used spatulas all the time, right? You can't think of the name spatula, right? Or you can't think of the grocery cart. That thing. Oh, you need to put this stuff. Whatever it is. You're having trouble coming up with words. Sure, you're going to remember easy words, phone and TV and chair and table. Those are simple. You're not going to forget those hardly. But at the beginning, you're going to forget words that are less frequently used. Spatulas or something like that, Or the computer mouse. Oh, that thing that the rat or the guinea pig no, it's a mouse. No, okay. You probably wouldn't come up with that anyway. But anyway, so you forget these lower frequency. That could be nouns. Get your brain checked out. Going to see someone about it. That's happening more and more. Sure, it can happen every now and then. Don't worry about it. If it's a rare type of thing, it all happens, right? Or we just slow processing, we just sit there, and after about 10 seconds, we go, spatula, normal, okay? So you're just processing through it. Don't worry about it. But if it's happening quite often, you can't come up with these words, that's not normal, all right? So you get in to see someone. Visual spatial, coming here to this beautiful campus with about 10 entrances and 2 parking spots, it was hard for me. Where the heck? I'm sort of circling around, and that person said, no, the front's over there. I went to the front, then there was no parking spot, and then I go, no. So it's possible I could got turned around, and I would hate to have done that because I would have missed that fabulous introduction of the nice bell ringing to introduce you to come here. I'm sure that's what it was. But so if you're unfamiliar with a place, no problem. You can get lost. Don't worry about it, But if you've lived somewhere for probably even a couple months, you should know your way around the place if you've been traveling there. If it's a local area that you're traveling all the time, you shouldn't all of a sudden start getting turned around. All right. It's a new place, yes, but if it's a place you've been and you travel that place and you're doing this and you're getting turned around, that's not normal. There's something going on with the visual spatial centers, usually back in this area. You should get checked out if that's the case. Now, a lot of times we have all these fancy technology and GPS, and they tell us, you could probably put it in, if you live here, in your room and says, take me to the dining room, and they'll probably tell you the best way to walk there for all I know. So that's one of the great things about technology, just as an aside. We use technology a lot to help people with memory issues. Very helpful. If you're forgetting things, well, gosh, technology can be there to help. You can certainly find your way because it's, take me home and tells you how to get home if you're lost driving. Or you can, if you go to a beautiful place like OSU and you're parking in this 12-story garage and you're rushing to your appointment and you come back there and you go, where did I park? I had to rush because I wouldn't want to be late for that doctor. Of course not. So you use your technology. You quickly take a picture of, 12C or something. You don't have to worry about it. Then you put it in your pocket and you go down. So you can use technology. I had this one fellow that had lost his memory, and this was due to an infection that he had. And he was a locksmith. Right? So he was still quite good with everything else. It's just the memory. So he would go in there, figure this out. Okay, I need lock H537285, And by the time he'd get back to his truck, he would forget it, of course. He would have wonderful memory before, so he could have done all that, knew all the parts, whatever. So he would just take his phone out and just dictate it. As he's working at the H324, I need this gear, this tool, whatever, he just puts it in his phone or dictation device, goes back to his car and listens, okay, I need to get this. So he's able to keep functioning using technology, for example, to overcome the memory deficits he has. So there's lots of things. We also have reminders, we have alarms, we have calendars, we have dates, beep, 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 time to take my medication, great help. So we use that all the time to help with memory issues. We're working on things to change the brain, but we do have things like that. Okay, so I talked about memory, language, day and date. It's okay to forget what the day of the week is or the date of the month. If you're retired, probably still a lot of you are still full-time jobs, But if you're retired or something, you might forget, and that's why I always keep a calendar. I can't keep things straight. So calendars are wonderful. Okay, don't worry about it. You're very busy. You've forgotten. You're off. But if you think this is November, that's not close enough. If you're messing up on the month or the year, of course, if it just turns January and you think it's the previous year, okay, don't worry about it. But so if you're really that disoriented with day and date, that's not normal, all right? Get in to see someone. Math skills, maybe you're not, maybe you're pretty good at math and you used to be able to add a couple numbers in your head and simple subtractions or multiplications and, things like this, so you could all do it in your head. And now you're getting older and can't do it. You give me a piece of paper and a pencil, yeah, no problem. I'm very accurate, can get it right. I just can't process it all in the time, maybe a tip, for example, I don't know. You could always figure out your X percentage tip that you give after a meal. So you go there you do all this in your head and I go, okay, I'm going to give them extra whatever dollars, right? And now it's like, I don't want to untip, so I use the pen there and I just do a calculation and it's perfect, right? So if you have to use a pen or paper or some supporting material and you're still able to do the calculations fine, that's normal, don't worry about it, all right? It's just the slow processing. Dementia would be, or the cognitive issue getting to see someone is, you give a piece of paper and a pencil, and you still can't figure it out. And you're going, let's see, 65 times 3, and you had come up with 68 or something. Well, you just added them. No, I said 65 times 3. Oh, and you can't, that's not normal, right? So if you used to be able to do that, or sometimes you just pull out your handy calculator, of course. So the calculations, how about planning, organization? That's mostly the fun part of the brain that does that. So maybe you always used to be able to plan your trips. You were the person that did the trip. We're going to spend a weekend down in Florida, or I don't know, whatever, a week down there. How do I do that? My gosh, a lot of things to do, right? You got to get the hotel and the flights and where you're going to stay and who you're going to visit and what you're going to bring and prepare all the people that were going to come to your house but can't come because you're not going to be there. You got to tell them, a lot of planning, organization. You got to get all this straightened out. You used to be really good at that. And now you're messing up all over the place. You just can't. You forgot to tell stop the paper. You forgot to tell a person that comes in to pick up the trash or the laundry or drop it for groceries or whatever. You didn't arrange any of this stuff ahead of time. You used to, but you couldn't do it. You barely even got your plane reservations. You don't know how to calculate. You just call people up and you get the reservations on the phone or something. You can't organize and plan as you do. That's not normal brain activity. It would be okay, normal aging, if you just take your time and you have, 3 days and you do it all and you accomplish everything. Great. Just took you longer than usual. No problem. That's just slow processing. But here you're messing up and you can't even keep up with that, and then you need someone else to try to help with that, or, you're just missing things. That's called mild cognitive impairment. Not up to your good standards. Should see someone about it. Maybe you were the secretary of a club. Always very good with the notes and the things, organized, checklists, everything, And now they're coming up complaining, I paid you last week. Remember, you should be checked off. I got that flyer already. I told you I wasn't going to, and you're not like checking things off and doing things. You're messing up on that. And it's not because maybe it's too much, maybe you don't want to do it, But instead of just saying, okay, forget it, you do it, don't quit complaining at me, you shouldn't complain to other people anyway, what? There's no purpose, just people maybe they're having a problem with their brain, So, be as always polite and kind. But instead of just saying, okay, forget it, I'm not doing it anymore. Well, you can certainly do that, and maybe that's good, relieve some angst for you, but get in to see a physician about it. Maybe there's something else going on that could be fixed, right? The last thing I'll mention is personality, change in personality. Now, personality is sort of defined as something that's very stable. We're not born, by the time we're a youngster, we have a personality and we stick with that, and we're pretty much the same person our whole lives. People that are very outspoken tend to be more outspoken. People that are introverts tend to be introverts. People are more moody, more depressed, more this, more that, more assertive, more angry, more whatever. It's our personality. We're going to stick with that, right? It's how our brain's wired, We try to mitigate the sharp points and things, but that's our personality. If there's a change in your personality, that's not normal brain. Whatever your personality normal was, if there's a change there, get in to see someone. Maybe it's horrible depression. Maybe you're just more obsessive compulsive. You never used to be that way. You're just like, whatever. Maybe you're more suspicioid. Maybe you're more angry and lashing out or something. Maybe you're more apathetic. Maybe you're less empathetic. Maybe you're more just me when you used to be a very caring person. Now you're just could care about no one except for yourself. These are changes in personality, which is not that person. Get in to see if someone. All right, so why is that important? So I'm going to end pretty soon. We'll open up for questions. But the reason that we do this, had you all, or those that wish to do the SAGE test there, was many years ago, I was just, people, as you imagine, people were just not coming to the doctor. Who wants to go to a doctor anyway? You know, my gosh, I don't really want to go to any doctors. I'd rather just stay at home and keep well and not worry about, you know, serious illnesses or cancers or this or that. But it was frustrating to me because we could actually do something to help people, and yet they would delay and come in too late, and there was nothing as much we could do, right? So that's why trying to help primary care providers and develop a test like SAGE that can be tested year over year. And of course, all you that are fancy with computers, we now have a digital version, you know, if you'd like to do it on the pad or the computer or something like that. But so our suggestion is you take a test like SAGE, just like you might take a blood pressure, you know. Fortunately, I have not had a history of high blood pressure, but every time I go into a doctor's office, I've never had it. Why? They keep checking it, you know. Okay, maybe I'll get it, all right. Yeah, but I get it checked every time. They also want to check my weight, and that has changed, but no, we won't mention that. But why are they checking things like weight and blood pressure, whatever, is for prevention. Why do you get colonoscopies or mammograms or prostate exams or whatever? Because we know at a certain age, the increase is, you know, the risk is going like this. So, yeah, if you're going to do a colonoscopy, you might as well get it checked because your risk of colon cancer and such a treatable cancer, for example. So the same as there's lots of treatable things for the brain. And so we're suggesting that you get a brain test, a quiz, like you're taking, and then, you know, I'm 65, I'm perfectly normal, no problems, and maybe I take this every year or something like this, and here I'm 72, and whoa, there's a change. We catch it early on, the first year, as opposed to 4 years later. So that's one of the reasons. And the last thing I'll tell you is about Alzheimer's disease is that because of these toxic proteins that build up, these toxic proteins build up in the brain if you're going to get Alzheimer's, which is very genetic, so it runs in families as well. These toxic proteins start building up 15 years before you forget your keys for the first time. Your brain is still working perfectly, but everyone can tell. But these abnormal toxic proteins are building up in your brains and keep accumulating for 15 years before you have any signs of any cognitive memory loss, anything. And we can tell, we can measure these proteins, either through spinal taps, lumbar punctures. Now we're working on blood tests. We're working on this p-tau217. Really exciting to be able to have a blood test to see if you have abnormal these proteins. Not there yet. It's not approved. We're working on it. And or a PET scan, which are really expensive, and most insurances aren't paying for them. But we can now tell many, many years, if you're going to develop Alzheimer's, many, many years before you develop any symptoms of Alzheimer's, we can tell you're probably going to get Alzheimer's. And now we're developing medications that are designed to get rid of or prevent the formation of these toxic proteins. We have this window of opportunity, and of course, we're not going to test everyone in the world just because they're thinking normally with expensive tests. Don't have healthcare dollars to do that. But if you're beginning to have the very earliest cognitive changes, someone notices some change in you, which is just not a normal aging thing, that would be a good time. Or maybe you've taken a test like this and you're just checking it, monitoring it. You can do it in your home. You don't have to go to the doctor's office. I would suggest giving these, you know, if you take it, to turn it into your doctor. When you go there next, just don't hide it. Doesn't do anyone good if you just, I did lousy on this, I'll throw it away. Don't want anyone to see that. You know, because that's the trouble with brain. People get embarrassed, you know. Two more stories and I'll be finished here. One was this guy that's in the office, and waiting for the doctor, sitting by this other guy, and he was saying, well, I had somehow they got into health. Frequent conversation, right? Health. And he goes, oh, I had a bypass operation a couple months ago. Bad heart disease. Why? Because he smoked and is overweight and has cholesterol and, wasn't a very healthy individual, right? And, but does it bother him? No. He had 3 vessels. And sort of proud to say, I got 3 vessels. I'm defiant, fortunately, And the other guy goes to him and says, I had 4. I got 4 vessels. I bought, okay, they're all jumping around, but I have never, ever had in my weight room someone that says, I missed 3 on Shari's test here. Oh, I missed 4. I missed 5. Okay, I beat you. They don't say that. Why? Because somehow they think it's reflective on them. Why is a brain any more reflective on your health than a heart is, or your toe, or anything else? It's ridiculous if you think about it. Why shouldn't you be just as proud if you got 4 vessel bypasses if you missed 4 on the test or 5? But you're not. You don't announce that because you think that has something to do with you as a person. Well, it's just an organ, just like your heart or your liver or your toe or anything else. Don't worry about it. Don't be so secretive about it. It's very important to have a good brain. So my point there is. Don't be embarrassed by brain inability. Do something about it. If there is something to do about it, get in to see someone. And for Alzheimer's, we can find out these proteins building up years before you affect your brain. And when you're beginning to affect your brain, and if we maybe get them out at that time, it's better than if you wait 3 or 4 years, the brain is more ravaged and, can't fix a dead brain cell. If it kills the cell, you can't fix a dead brain cell. We're not so good at stem cell transplants and everything for the brain. So if you can, the cell is sick with these proteins and you can get rid of them and the cell's not dead, okay, that's better than a dead cell that never will regain life again, right? So think of it that way. And so the last thing I'll bring up is, the issue of clinical trials. So we do lots of treatments and we have lots of clinical trials at OSU. And we have clinical trials to try to help find better treatments, better ways to diagnose these conditions that then we can get people in early to get treated early for their brain and brain health so they can have a nice, better life with a better brain, right? We have treatment or clinical trials for people who are thinking normal, but maybe at risk for Alzheimer's. We have trials for people that have a little mild cognitive impairment. We have trials for people that have dementia. We have trials for Alzheimer's and Lewy body. We have trials for some behavioral issues, personality changes. We have trials for a whole variety of things. And we are dependent on the altruism of all of you people or anyone that comes into a trial. We are dependent on people to volunteer and say yes. And so some of these trials, they may be on a placebo, a fake stuff, and others on the real stuff, but it's the only way that we can get any of these drugs out to not only to you guys and your friends and families, but probably the next generation as well. Your children and grandchildren, et cetera, will benefit if we get these done faster. So you have the opportunity, I think on the sheets there's a question, is if you're interested in trials, it doesn't commit you to anything. You just say, I'm interested. If you're not interested, that's perfectly fine. There's a lot of trials we don't want you, because you have 2 other conditions and you don't fit the criteria, But if you think you have time or energy or wish to do it, we're very appreciative of that. So I'm going to end there. We'll open up for some questions, and I guess if they finish the test, they just raise their hand, or how do you want to do it? I'll repeat. So if they raise their hand, they'll be taken to be graded.
Yep, and we'll bring it back and get it to you.
And bring it right back to you and tell you tell you what you did. And
There's plenty of time for you to do it now and finish. There's plenty of time still for you to fill it out as he's doing questions or after, so don't feel rushed. But if you're already done or as you finish, just go ahead and raise your hand and we'll gather them and bring them back.
Yeah, by the way, we don't let you out of these rooms unless you finish. Just to keep that in mind. Or the alarm will go back on. That's completely up to you whether you do it or not. Yes, sir. So great question. So the question was about concussions. So goes back to sort of the brain trauma, right? So concussion, your brain is shaken up and banged against the bone, the hard bone of your skull. And concussions are not good for the brain, period. The bigger, and there's a variety of things. So you could be concussed and see stars or something and then recover in 5 seconds, all the way till such severe brain damage from a concussion that you're in a coma or die, and everything in between for brain trauma. So, yes, they're horrible, and how many depends on the degree, where it hits, what part of the brain, how severe the concussion is, how big, how much the turn. If you're in a car wreck, for example, would it flip over, or you just bang straight like this? All those make a difference as to what part of the brain is damaged, squished, contused, bruised, is basically a bruise of the brain. And sometimes it's hard to say, so we can measure over time. So the only thing I could say about that is, wear a helmet if you go bicycle riding. Certainly if you go motorcycle riding, maybe avoid sports where, you get your head concussed. So it's more prevention type stuff is the best is for, preventions. But very important, very critical. Yes?
Could you talk a little about the effect of medications on dementias? I've read that statins, which are prescribed commonly to treat hypercholesterolemia, that the lipophilic portion or the type of statins can cause dementia. And I'm curious as to why, or what's the connection?
Okay, so the question was about medications. Of course, there's some medications that are not good for your brain, but maybe good for your cancer or something like that, and you have to put up with chemo fog or chemo brain, so we take a choice as to what we do. And then in particular, there was a question about statin medications for high lipids, cholesterol, triglycerides, those types of things. So very interesting. So with Alzheimer's disease, in vascular dementia disease, statins are fabulously important and useful drugs. In terms of, because the cholesterol builds up in these little blood vessels and clogs them up, and the brain, you clog up a blood vessel, well, that part of the brain dies. It's not helpful. So lowering your cholesterol or lipids, triglycerides are extremely important, and statins are one of the best tools for that. So if you've had a stroke, statins are like the first thing we start on day one. Very important to control those. If you have a family history of cholesterol or strokes, gosh, statins are really, really important to take. Can you have side effects on statins? Sure. If people have muscle issues, other things, maybe you can't tolerate it. Maybe they'll try a different one, or maybe you just can't tolerate statins because of side effects. But most people tolerate really well. In fact, statins are probably one of the best drugs that have helped with longevity in the last 50 years. I mean, they've been fabulous drugs. In terms of Alzheimer's and statins, they
General dementia and statins. There was some correlation between the two.
So I don't know about general correlation between dementia and statins. I think that statins are excellent for Alzheimer's. Alzheimer's is probably 50% of the dementias as you get older, so it's a huge part of them. But in Alzheimer's, people that took statins, like in their middle age, decreased their rate, and this is overall dementia actually, decreased their rate of dementia by 50 to 60% for those that did not take statins for their high cholesterol. We've tried statins in people that had dementia, and it didn't seem to do much, so it was maybe too late. For Alzheimer's in particular, we fed they have these different models of mice, right, to make them look like they have Alzheimer's disease. And we gave them high diets in cholesterol, so they perform cholesterol. And we gave them statins. They reduced their amount of that toxic amyloid protein in the brain. We looked at humans, and the humans that took statins, we said, what statin did you take? And they took a whole list of these different statins, and the one that had the best reduction of dementia, the best reduction of getting Alzheimer's later on, was a statin called simvastatin. And it turns out that simvastatin, that's the Zocor, has the most brain penetrance of any of the statin molecules. It gets into the brain the best. Some statins don't get in at all, and they had the lowest chance of reducing dementia risk. And the ones that had the highest rate was the ones that got in the brain the best. That's simvastatin. So my recommendation, if you have a family history of Alzheimer's and you have high cholesterol, I tell people, switch to simvastatin. It's generic. Hopefully you can tolerate it. That had the best, and this is in retrospective studies, so it's not like prospective, but we have data from humans, we have data from mice, we have data from all sorts of things that says it may affect the transport of amyloid, which is that toxic protein in the brain. So vascular dementia, they're great for. Alzheimer's, they're great for. That in and of itself is probably a good 70-80% of all dementia conditions. So I can't imagine a study that shows that statins are bad for dementia. Now, you can have a side effect from statin that cause confusion. And yes, okay, for that person, not working well. But in general, on the average, statins are fabulous for most individuals to help reduce dementia. Yes?
I've heard that taking anesthesia when you have surgery when you're older is hard on the brain.
So the question was about anesthesia, especially if you're older. You may never recover. And so there's a few things about that, and it's been debated. But usually the people that have this decline, and it happens after a surgery, and it's certainly, usually anesthesia is the main thing that gets blamed, but a lot of the surgeries can be related to like a valve surgery in the heart or a vascular surgery or things like this, during the surgery, you could flick off little stuff, whatever, that goes to the brain that you wouldn't pick up on an MRI scan. And it gets blamed a lot on this anesthesia. Anesthesia in and of itself is temporary, and it gets out of your system. And so why it would cause a permanent death of cells is, it's not likely, right? So most of it is thought to be related to that. Plus, after a surgery, sometimes you're on medications. If it's orthopedic, for example, they usually give you more than Tylenol after a surgery as well. So there's lots of effects on opiates. There's hundreds of opiate receptors in the brain, hundreds of these pain medications that you take, a lot of receptors in the brain. The anesthesia, of course, works in the brain, but it gets out of your system because they design it to do that. So I think most of the issues with anesthesia after surgery or something like that is mostly falsely accused to the anesthesia and more likely due to some of these other issues, infections that you get after surgeries, all sorts of things. You're in ICU and you're in a strange place and you have, weird thinking and depression and anxiety and everything else can affect your thinking. So if it's something that you need to do, I would definitely not put anesthesia at the top of the list as to whether I do it or not. It should be based on other things. Yes?
Can you talk a little bit about those of us that have had chemotherapy and how that relates to aging of the brain?
So the question was about chemotherapy in the brain and just like radiation therapy as well. Those can all affect the brain. If it's chemo, it would be usually temporary while you're on it. So every toxin that you're on, if it affects the brain, is going to be the worst at the time you're on this toxin, whether it's chemotherapy, whether you're, someone slipped the arsenic in with you, or whether you're toxic from, you're an alcoholic for 50 years or drug user or work at a manganese mine or something. Whatever the toxin is, if it's going to affect your brain, which many toxins can, the effect of the toxin will be the worst when you're under exposure, right? So it definitely would not be the case that I had chemotherapy, I was exposed to all these chemicals at work, and, think it's a work-related thing, or Agent Orange, or whatever it is, and now, 20 years later, I'm having toxic effects on the brain. The toxins don't work like that. They're going to be the worst when the toxins is actually there and working as the highest, right? If anything, it will get less. You may have damage right then, and you can have toxicity to the brain, no question. But if anything, it'll be worse when you're on it, and maybe it gets a little better or not as bad, as you're further and further out. Some things like Agent Orange, for example, we think is an increased risk of Parkinson's, right? So that is maybe a more delayed effect. People with Parkinson's conditions, a lot of toxins are related to Parkinson's. Well water drinking, pesticide use, Agent Orange, all these things. So it is, Parkinson kind conditions can be highly related to environmental toxins. Alzheimer's typically not. Alzheimer's is more genetic. People have looked at toxins to cause increased risk of Alzheimer's, and we hardly ever see it. So chemotherapy shouldn't be causing Alzheimer's disease. It can damage the brain. The further you get away from it, probably the less impact it would have. Yes?
Do you think exercises help, like doing puzzles and?
She said no, No, okay. I misinterpreted that, okay. No, great question. So the question was, does exercise help the brain? Yes, thank you for bringing that up. So there's other things you can help the brain with. And in my opinion, the two biggest things to help the brain the most, because it works on sort of the whole brain, is physical exercise and socialization. Now, because of COVID, that's been a problem for the last couple of years, and hopefully we'll get, till the next variant comes, we'll be better probably. But physical exercise is good for your muscles, but it's great for your brain, because your brain has to control, I'm feeling tired. Oh, that felt like it was a twist. I better not do that. I better adjust this. I better do that. Your brain is constantly working. I'm getting less oxygen. I'm going to slow down. I'm going to speed up. This person's going faster. I'm going to motivate the brain is working all over the brain. It's a great brain activity. I'm a firm believer of use it or lose it, right? Just like anything. If you sit around and don't use your muscles, they're going to atrophy. They're going to decay. You're not using your muscles. They sit there. You're going to be weaker. I think to a different degree, but the same effect as the brain. You use it, you're going to be more active, you're going to build up more reserve. So even if you get something like Alzheimer's, you have to get through all the reserve to get to the core area of brain that you're not building up. So learning how to, shuffleboard or a new activity, or piano playing, or doing, puzzles, game puzzles, jigsaw puzzles, computer puzzles, all that will help different parts of the brain. But the ones that help the most overall, I would do all of them. You like a mixture of things, but definitely is exercise and socialization. Yes?
I walked into a glass wall and destroyed my brain. It's pretty much totally. God has given me the best husband in the world who takes care of me. But also, you're looking at a group of the kindest people in the world here. Because they are also nice, and they all know that I'm losing.
Okay, so the question there was, everyone marries someone like Bob. But he's the greatest. So yes, thank you for sharing that. And her comment was that she appreciates all her friends here that help her out because her brain's not working well. And we have to help everyone else out. If we see someone that doesn't have a leg or is having trouble getting up a curve or something, glad I don't have that leg problem. I'm going to help them maybe get up the curve. You see them teetering, you're going to try to catch them, right? If they have a brain problem or confused, you're going to try to help them, show them, here's where you go, sit down here, don't worry about it, and help them with what they need. So that's the human nature. Yes, sir?
There
Do I think that people's personality don't change over time? For the most part, they don't, unless there's something going on in the brain. So did you have a good example to tell me?
No, there'd be something going on in her life, a death, or other things that change your personality.
So that's an excellent point. So yeah, in terms of change of personality, people go through normal grieving process, for example, yes. But what's a normal, if you're talking about some close person passing, what's happening to your brain is your serotonin, norepinephrine signals are getting all messed up. You have a chemical imbalance in your brain, and that's a normal type of thing that humans go through, and it's probably useful for lots of reasons for humans to have this process. But it is a change in your brain that's occurring. That one usually is hopefully temporary, so that after a while it's going to get less acute. And some people do better than that than others. But
Don't you think it would make you more compassionate to others without changing your brain?
So there's a wide range of human emotions, compassion, etc. So it's not like you're always incompassionate or you're always compassionate, so everyone has a mixture. So you can be more one way or the other and try to train yourself to be a little bit more kind or compassionate or whatever. Definitely, there's a range. So maybe maybe I should have said better is so when you get outside this sort of range of where they usually were, if they're outside that range of their normal human experience, and for personality changes when they're outside the range, you would know it. You can tell that it's definitely different than their usual personality, but that's a good question. Yes, sir?
If there is a family history of Alzheimer's, are there any genetic patterns or probabilities you can elaborate on? Siblings, brothers, male, female?
Yeah, so the question was about genetics and Alzheimer's, and there are some mutations on genes that if you have that mutation, 100% chance, if you live long enough, you'll get Alzheimer's. These are very rare mutations that occur in less than 2% of all Alzheimer's, but still they exist. And there's a lot others, and those are usually people that start very early in age. In other words, they're starting at age 45 or 50 or something like this. There's a lot of genetics also for people that are older, say 75s, 80s, these are anywhere between 70 and 90, I guess, where it also occurs very frequently, and we don't know all the genes. There's probably about 30 different genes that will impact the amount of toxicity for these, increase the number of amyloid or tau proteins that build up. And there's a blood marker called apolipoprotein E that is one you can get in a blood test that will measure, you're a little bit increased risk of getting it, later in life. It doesn't mean you will get it or won't get it, it's just a risk factor. So we have those types of things we're measuring. If it runs in your family, most of the time, if mom had it at age 70, most of the time the next generation will get it at about the same age, within 5 years or so. So it's going to typically, and if you're getting it at age 50, then a lot of times if it hits the next generation, maybe about the same. You can have Alzheimer's just spontaneous, just not really genetic, and we're still trying to figure out some of these idiopathic causes. So they're not all genetic. And so you can have a parent, for example, that had Alzheimer's and no one else in the family ever will, or, at least in several generations. So unfortunately, it's not something you can plan, but if you have 3 or 4 in your family, then you say, well, this is probably genetic, right? There's just one, they're the only person out of everyone that you know of in the family, less of a risk. But if you have 2 or 3 or 4 and, your uncle and your mom and your grandmother or whatever, chances are, unless you got all the stuff from, your dad's side or something, then, there's an increased risk. And so for those people, that's why it's so important to consider some of these early diagnostics, to see if it's at risk for you and that there's something that we can do about it. And those disease-modifying agents are actually, the first one was approved last June, it's controversial, but the one that was approved by the FDA in June, is a disease-modifying agent that gets rid of amyloid in the brain. So we're beginning, it was just first baby step, and we're working on anti-tau, anti-amyloid, anti-inflammation, lots of different things that are going on right now. Very exciting in the field of therapeutics for Alzheimer's. Not there yet, but we're making steps, and we've already had some advances just even as of last June. In the back, yes.
You've mentioned that you want to get things early on, yet you keep talking about what you're going to do as if it's not a regular thing right now. How much can you really do? And it just frustrates me that the insurance companies are controlling what you can do when you have to start those.
Right. So the question was, what can we do now? So the meds that have been out for years, since mid-90s to mid-2000s, these are things like for Alzheimer's. These are things like donepezil, rivastigmine, galantamine, memantine. All of them work better the earlier you start. Do they get rid of the disease? No. The disease still gets worse and worse, but they work for about 8 years. Eventually, the disease wins and catches up, and they don't change. They won't change when you're going to die of the disease or how long the disease is going to last. They just make the brain work better while you're going through it. So instead of like a steady decline like this, if you're not treated, you have more of this curve. And so those are the ones that are currently there right now. And if you're 80, 85 or something, and you begin to have Alzheimer's, well, shoot, I want to be in that curve at least maybe for the next 5 years. I might die of something else by 90, I may not live to 95 or something. And so I have my whole life, I'm doing pretty well with these drugs. So they work better if you use them and if you don't. The current one that was in June, aducanumab, anti-amyloid therapy, it gets rid of this toxic amyloid. And again, if you don't catch that early, the other brain cells are already dead or dying, and you can't revive them. But if you catch it early when the brain cells are just sick and not dead, so that's why it only works at the very early stages.
How do you test for that?
Did you take your SAGE test?
That has to do with.
It has to do with cognition. And so if you're seeing you're doing really well in the normal range or something, and then all of a sudden you're dropping to a little lower level, perfect time to maybe consider, that's when we usually start people on these medications. If we find, and we can test them, as I said, for amyloid. We can test for tau and amyloid in their spinal fluid. We're working on that blood test we're talking about. It's not out yet. So we can test. You begin to have little problems. Do you have amyloid? Yes, you do. Here's an anti-amyloid treatment. It gets rid of the toxins. The other medications we have don't get rid of the toxins, but they help improve, slow down the course. So those are also good to take. And we're developing new ones if we get the trials finished.
We see a lot of advertising for Prevagen.
Yeah. I've heard it too. I just turn it off.
Is it supposed to be in prescription or is it?
No, Prevagen is it's not a prescription, so they don't have to go through any rigor. It's not FDA approved. It's just a vitamin type thing. If you look what's on it, it has mostly vitamin D and a few other things in it. So, they have some they have testimonials, There's getting close to 6 million people with Alzheimer's disease, right? And I could probably find 2 or 3 people with Alzheimer's that say, my snake oil also works well, out of 6 million. I could find people to say that, especially if you pay them. So the truth is, we don't know. Prevagen is very safe. I don't have any problem with people taking it if they want to pay for it. But there's no evidence that it helps in people that have things like Alzheimer's disease. They think it helps maybe with normal aging, but I think you can do just as well with exercise and socialization and other things. Vitamins, you need vitamins. Vitamins you need for your brain to work well. So that you have to have a well-balanced meals. You have to get your vitamins in. You have to have oxygen. Oxygen, need that for your brain. So there's these basic things the brain needs, and if you're deficient in your vitamins, yes, your brain won't work well. Yes, get on a vitamin. Very important. All this other stuff, how they combine them into, the number one selling drug for years, for hundreds of years, has always been a memory-enhancing drug, always. We had ginkgo biloba, hydrogen in Germany. I mean, multiple vitamins. They've all been touted for improve your brain, right? And they're always been the highest selling drugs there are. For hundreds of years, it's always been that way. It's the next thing, right? We're trying to focus on drugs that actually pinpoint diseases, you know. So people have always been taking these types of things, always. And some people have better advertisements for there's hundreds of, you look in the stores, there's hundreds of memory-enhancing drugs, you know. One advertises better than the other one, that's all, you know. If you have stock in the companies, buy as much as you can and tell your friends to buy it. That's what I would say, you know. Yes?
You told me that I hadn't known before that cells are actually dying in the brain. When I'm learning a new skill to improve, to keep it going, what part of my brain is learning?
Yes, excellent thing. So I keep saying about you can't regrow cells, but you can regrow connections. And you can make connections, synapses and connections. So if you're learning to play the piano, you know, your motor control, sensitivity in the hearing area because you're listening what your music that's coming out or not coming out. It's all enhancing. It's enhancing those synapses and building new ones. You can build synapses, you can build dendrites, you can build connections, definitely. And in fact, you're learning a new skill or bowling or whatever it is you're doing, yes, your brain will be doing that. If you're doing Sudoku every day or crossword puzzles every day, your vocabulary, your math centers, yes, it's the logic centers, you know, jigsaw puzzles, whatever, it's growing in those areas. If that cell is dead, then of course all those connections are dead too. But, you know, so it's not more cells, but it's more connections of the cells you have that gives you more reserve. At least that's the thinking. Yes, sir. And by the way, please, if you have to go somewhere, you're more than free, you know, we're in the question answer center. You can turn your test in over there, whatever. So you don't feel like you have to be polite to stay here and listen to all these wonderful questions or listen to me. And you're more than welcome. Is that true? Do they have any? They're free to go if they want, yes. So just to make sure that I am not offended. You can stand up, turn your back to me, leave, no problem. Yes, sir.
You were talking, what about long-term and short-term memories? Because you talk to some people who do have dementia or Alzheimer's, and they can remember everything they did in Korea War or whatever, and you ask them about what they did yesterday. No clue.
Yeah, so the question is, are there different memories? Yes, there are. And the Alzheimer's affects the encoding area, which is here. So new stuff can't be encoded, which means it can't be stored. So only new stuff. Old memories are all over your brain. So you got smell memories here and hearing memories here and visual memories here. And, you know, they're stored everywhere throughout your brain, different memories that you have. And if they're old, like wartime or childhood or school age or whatever it is, those are going to be not going to be the first things that go. They'll remember those well. Now, if the brain is ravaged in Alzheimer's disease and you get to a stage that you can certainly lose old memories because a lot of cells are dying. But at the very beginning, we just have trouble with new. That's why you don't clue well, you know, when people give you a clue as to what you did yesterday or something like that. But the old memories are usually really clear, and then the person usually likes to tell the same story over and over and over that you've heard. But yes, again.
You mentioned there are hundreds of causes for dementia. Can you name a few of the most common ones that might cause dementia?
Sure. So if for older age group, Alzheimer's is probably the most common. There's a thing called Lewy body dementia, frontotemporal dementia. These are all degenerative conditions. Vascular dementia, that's from strokes.
What causes this?
So these other proteins, there are other proteins. So Lewy body is due to this protein called alpha-synuclein that is abnormally produced and builds up and toxifies the nerve cell. TDP-43 is very common in frontotemporal dementia, hits different parts of the brain. Again, it's a proteinopathy.
There's biochemical something going on.
Yes, terrible biochemical proteins, deposits, toxin stuff that destroys the cells. There's inflammatory, you can have an infection of the brain, HIV or herpes, encephalitis, or from some mosquito bite, all sorts of things. Trauma, we talked about that, cancer, tumors, if you're not getting enough oxygen to your brain doesn't work well because you have hypoxia. If you don't have good blood area capacity, perfusion, if your heart's not pumping, doesn't get enough blood to your head, so you have perfusion problems. Kidney or liver aren't working well. They get rid of toxins, right? And if they're not getting rid of toxins, they go floating to the brain, and your brain gets confused, just like medications. You can toxify your brain with medications if they're too harsh for you. So those are a few of the causes. Yeah, and stroke, that's the vascular cause. So stroke's very, very common. Exactly.
Has anybody ever done any research with the use of music, the different vibrations of different tones?
Yeah, so her question was about research in music, and that's I think, needs probably more so, but it seems very, very useful for calming and to prevent irritation, irritability, and things like that. So. And for stimulating the brain. There's, yes, people are using it. People are doing things. One guy has this helmet that you put on, and you hear music. It does a nice massage, has visual things. What they're trying to get at is, visual, auditory, sensory. Trying to with just one helmet. There's patents on this. So they're trying to increase stimulation. And so music can be very comforting because if it's the kind you like, because it's familiar, gets you into a better mindset so you're less anxious. That helps your brain too. So there's a variety of reasons. Music can be very, very important. Yes?
What's your most exciting research project that you're involved in right now?
The one that I'm doing. No, so I'm one of the things, so we help out with a lot of these different, some of these large pharmaceutical companies to get their drugs out, and that's very important. So these are anti-amyloid, anti-tau therapies. I think theirs very exciting. There's one that hits it's a small molecule that hits both inflammation and also reduces tau, so that's very exciting. None of these I'm devising or developing or anything like that. So yes, I love all those things. They're great for that. Right now, my favorite topic is to work on enhancing diagnosis and getting people in earlier. So it has to do with, so this SAGE test you took, I'm the inventor of that, so I'm a little biased with it, but we made it a digital version of it. And the next step is actually to be able to put it onto, as opposed to a tablet, a smartphone, plus a mouse with a computer. And we're working at telehealth so that we're trying to get these things out to these people that most of America, most of the world is in areas where there are not a lot of people with knowledge of cognitive disorders, how to treat, how to diagnose, et cetera. And so they're stuck in these areas. They have no one that knows anything about the disease. So we're trying to work on getting these tasks out there, measuring there's a problem here, and then we're also working on telehealth or telecog, I call it. So that is getting like the experts at OSU, for example, to be able to just video in, like with this pandemic is only one of the best things that have happened, I guess, is that Medicare is paying doctors for video health as opposed to they didn't used to pay for that, right? So it's useful for people who are living in areas they can't transport, maybe inner cities, minorities that have no transportation, or rural areas have no transportation, or just so far away from big centers they can't get in there, or who wants to travel all that distance. So one of my main focuses right now that I'm working on personally is getting, one of the reasons for this talk as well, is getting people to identify these issues early, and then we're also working on the treatment aspect of it so that then we can actually give treatments. Yes?
Yes, are women more predisposed to different forms of dementia than men?
Oh yeah, the question was, are women more predisposed to dementia than men? And Alzheimer's, yes. So women get Alzheimer's more than men, and a lot of that is because they live longer. Those poor men die off, and so, Alzheimer's is a disease of the aged, and so, if you live longer, it's more likely to get Alzheimer's, right? And those men, who knows what they're doing. But anyway, they die off. But even if you take that into account, women still get it more than men, even if you take away the age effects. So, and we're still looking at, there's a lot of theories about why that is, and the Women's Health Initiative and memory study shed some light on that. But we've learned that, you should not take progestins past menopausal age, things of that nature. But we haven't quite figured out exactly why that is. Now, for Lewy body dementia, for example, men are more likely to get that one than women. Lewy body is less, it's probably the second most common degenerative condition, but yes, there are definitely sex differences between these conditions. And yes, sir,
Okay,
in the back.
sorry to interject
Okay.
here. Just wanted to take a moment, first of all, just say thank you so much for your time, Dr. Shari. We really appreciate it. And just that we're going to take 2 more questions and then cut it off just to be respectful of your time.
Two more
Thank you again.
Thank you. No, okay, thank you. Yes, sir.
Have you looked at any way at the effects of anesthesia on the brain of elderly people in the 80s and 90s?
It's an excellent question about anesthesia, and one of the things that we have done, it's just a preliminary study that was published at OSU, but that we met, and it doesn't really explain, all the different nuances, but before and after a surgery, we've had people take this famous SAGE test, so that we can at least measure their thinking processes before and after to get a better idea as to, what the degree and what type of people and what kind of surgeries and what other differences, why some people may have a drop off and others don't. So we're still at this sort of figuring this out stage. I gave my theory as to what I thought was some of the issues with that. But so there's been a little bit of research, but not a whole lot. More needs to be done for sure. Okay, who wants to be the last question? She scared you. Okay.
Something about when
Oh, I'm sorry.
the elderly, just like everybody else, have too much change. There a lot of things, like for instance with me, I could say, coming up here, leaving Florida, crisis in the family. I still have a hard time, and I love it here, but I feel like my brain is not functioning like it used to.
Yeah, so the question.
In a few weeks.
The question is, the more stress you have, the more things on your plate, the more, death of a loved one, moving, new doctors, new this, new that, all these things, no question, they're increasing stress levels. You have lots of stress hormones that are going on. They all affect the brain. These are all physical, real reasons, just like grief we talked about. All of these are reasons. They're chemical. The brain is like the biggest chemical milieu that we have in our body. I mean, it's just incredible how many chemicals are going on. So all these things will make the brain work less efficiently, less well. And so you have to do, try to get things, meditate time, mindfulness, yoga, thinking, massage, who knows? Everyone's different. Music. I don't know the answer to that, but you try to find something best for you to say, I need time, maybe just for myself, and I can, too much hubbub, right? Give me more time, I'll take this slow or something like that. Thank you all very much.
Thank you so much, Dr. Shari.